All right, guys. IV fluids are one of those topics that students tend to either just memorize it or take it to the point where they actually understand it. Today, we're going to make sure that you understand IV fluids, and we're going to do that using something very simple, sweet tea. If you can understand sweet tea, then you can understand IV fluids. So let's get started. You're going to want to think of the body like sweet tea. Now, this is a great slide to pause and take a picture of and utilize for studying. First off, we're going to look at three components that are going to be making up the sweet tea. One is water, which is going to act as our fluid. The second is sugar. Sugar is going to represent the particles like sodium and glucose that we find in various types of IV fluids. And then lastly, the tea bag is going to represent the patient's cells, and this is going to be important because the cells are going to be what changes in our patients based on the type of IV fluids that we give them. The golden rule is that water follows sugar. In this case, that's going to mean that water moves towards the higher concentration of particles. Now, everything within this video will be relating all fluids, all concentrations, everything back to actually sweet tea. So if we refer to sugar in the video, that's basically going to mean the concentration of particles, whether we have a little sugar, just the right amount of sugar, or maybe even too much sugar. So let's meet the cell. The cell is going to be the tea bag that's floating around inside of your glass of tea, helping to create that tea. Cell for us is going to equal normal balance. We always want a normal balance so that we have homeostasis within the body. What we want is an equal concentration on both the inside of the cell and the outside for the cell. So for example, with the tea bag, we want the exact same concentration of sugar or tea concentrate, if you will, on the inside of the tea bag as well as on the outside of the tea bag. If we have the same concentration, we have no drama, we have no swelling, we have no shrinking, we just have balance. All right, so we're going to start looking at the three types of IV fluids. Let's begin with isotonic. Everything you need to know about isotonic is on this view. Isotonic would be our perfect sweet tea. It would have just the right amount of sugar to balance out what the sweet tea will taste like. In regards to the cell, it's going to have the same concentration as the cell. So we're going to have an even amount of concentration of sugar within the tea bag versus outside of the tea bag. Because of this equal amount, there will not be any shift of fluid that transforms how that cell looks. So the cell will remain happy and will stay the same size. Examples of isotonic fluids, the two most common ones that you see as nurses will be 0.9% normal saline and lactated ringers, often referred to as LR. Now, one of the tricks to remember what different types of IV fluids are isotonic is remember that number of 0.9. If you have 0.9% normal saline, that is isotonic. If we have a lesser number, that's going to mean we have a hypotonic solution, and if we have bigger numbers than 0.9%, we are going to have hypertonic solutions. And we'll talk about that here in a second. Let's talk about some risks, though, with giving an isotonic solution. So why would there be a risk if this is supposed to not change the cell and doesn't allow any fluid shifts. Well, the whole goal of isotonic solution is to simply hydrate the patient that may have lost just some volume. They haven't had any shifts of fluid in or out of the cell, they've just lost some volume. For example, basic dehydration or maybe even blood loss. We would give isotonic solutions to those types of patients. But we do want to be careful because we can still give too much volume. So with that volume, we might create fluid overload or even pulmonary edema, which is swelling within the lungs, if we give too much fluid too quickly. So we just want to be very careful on how fast we administer any sort of isotonic solution. Now let's talk about hypertonic solutions. So hyper means high, tonic means tonicity. So this is going to be a high level of tonicity. In other words, for us, it's going to be a very super sweet tea, a high level of sugar inside of the tea. So if we look at this tea glass, well, most of that tea, it's very dark, it's full of sugar. There's actually more sugar particles than there is fluid. So because of this, hypertonic solution will cause these cells to shrink up because it's going to be pulling water from the cell out into the rest of the tea glass, if you will, to try to balance out what's occurring. And we'll talk a little bit more about this in depth at the end of this video. When do we use hypertonic solutions? Well, hypertonic solutions are high concentrations of solutes. In this case, we're going to say sugar in our sweet tea. It could also mean maybe high levels of salts. So if a patient has hyponatremia or low levels of sodium, they might benefit from a higher level of sodium tonicity or sodium concentration. So we could raise those sodium levels by giving a hypertonic solution. We might also use hypertonic solutions for patients that have cerebral edema. This is going to be swelling of the cells around the brain. Now, hypertonic solutions will be given specifically to pull fluid out of those cells because the patient's cells are already huge. They're super swollen. And what the hypertonic solution is going to do is pull water out of those cells and try to get them back to normal. Of course, there are risks with giving hypertonic solutions. We want to be careful that we don't dehydrate the cells, meaning we don't shrink the cells too much. The goal is to shrink cells, but to shrink them back to normal, not shrink them so they look very shriveled up, almost like a raisin. You want to make sure that you're checking your patient for neuro changes, like confusion or even headaches. These can be changes or side effects of us giving a hypertonic solution inappropriately. And just like we had with isotonic, we still want to be very careful of fluid overload, just with how the rate that we're giving these sorts of hypertonic solutions. Now, I mentioned in the last slide that isotonic solutions, we can recognize these by the 0.9% normal saline. And I said that if we go hyper, we have higher numbers. So in cases like hypertonic solutions, you'll see larger percentages like 3%, 5% normal saline, 10%, or D5W types of solutions with these hypertonic solutions. So look for those larger numbers to help you recognize that you have a hypertonic solution. All right, so you recognize that there's three groups of IV solutions. We stated that isotonic does not change the cell. It simply hydrates or gives extra volume. Hypertonic solutions, that's our super, super sweet tea that has a lot of sugar or a lot of extra concentrations like sodium, and that's going to possibly make our cells shrink because of the way that the concentration is moving in and out of the cell. And the last group was hypotonic solutions. These solutions have very little sugar. It's very watered down sweet tea, probably doesn't taste that good. And these cells will eventually swell up if they are given hypotonic solutions. Now, the goal here is that you just don't memorize what those fluids are, but that you can actually identify and ask yourself, what would the cell look like? What's going on with my patient that would require me to pick an IV solution, and what does that cell need? What IV solution do I actually have to pick? So before you pick the fluid, you want to take a look at the cell. Let's start at the left. If the cell is already shriveled up, the patient cells don't have enough water, they're shriveled up. The patient might also have dry mucous membranes. They might be very thirsty, be confused, or you test some labs and they're showing high levels of sodium. You have to think about what those shriveled up cells will need. So what sort of IV fluid would you give to a little shriveled up cell? You would give hypotonic fluid because a hypotonic solution would move water into the cell and provide the water that that little shriveled up cell needs. If the patient was experiencing either blood loss or dehydration and there were no really other symptoms, we would probably recognize that the patient's cells are normal. They're currently balanced. The patient just needs some extra volume. If all they need is volume, we would want to give an isotonic solution. This would give the patient extra volume to replace any sort of blood loss or dehydration, but it wouldn't change the cell at all because the cell's perfectly fine right now. It's in our perfect sweet tea phase. However, if the patient has cells that are swollen, meaning they just have way too much water inside of their cells, not a lot of sugar. Remember that watered down sweet tea? These patients might experience headaches, extreme confusion, seizures, and low sodium levels. If these patients' cells are already really swollen and full of water, what sort of fluid do we need to give them to remove the water from their cells? You will want to give them hypertonic IV solutions. Solution that pulls water out of that cell, lowers the surface of that cell, and starts to shrink it just a little bit back to normal. All right, let's give you an example here, and you pick the fluid that you would give. So for our patient case number 1, the patient's sodium is 150. Now, in case you don't know, normal sodium levels are 135 to 145. So think, is that sodium low, normal, or high? It also states that the patient is thirsty, and they're saying that they're very dry, meaning that they have some dry mucous membranes. So first off, think about that patient information and interpret what might be going on. They have high concentrations of sodium, so could they possibly be maybe super sweet tea? How do we balance this out? So first think, what does that cell look like? Where's the water? Remember, water follows sugar, water follows sodium. If the blood is super concentrated, water will leave the cell. So then what happens to the cell? It's going to shrink, right? The cell will shrink if water leaves the cell. So that's what the patient's cells will look like. They're going to be dehydrated. So if the cells are dried out, what do they need? Well, they need water. So what sort of IV solution do we give the patient to push water into their cells? We're going to give them hypotonic solutions. That is going to push water into the cells and make that cell that's shriveled and super concentrated go back up to normal and start to balance out. Our next case, let's look at the patient information and interpret. So the patient has been experiencing blood loss, and we also have a vital sign change to hypotension. So that hypotension is probably going to be related to the patient's blood loss. Now remember what we talked about if we're just losing volume. Will the cell be changing? Does the cell look different? In this case, the cells are perfectly fine. They're not changing. They're not dehydrated yet. They're just losing volume, nor are they swollen. So if the cell's not changing and we don't need to help in changing it, which IV fluid would you give? If you said isotonic, you are correct. We don't want to shoot fluid in or out of the cells, so isotonic would be appropriate. We would just be increasing the patient's volume to help with the blood loss that they've experienced. In our last case, the patient's sodium is 128. Remember, sodium is 135 to 145. The patient is also confused and has a headache. So based on that information, what do you think that patient's cells currently look like? Remember, water follows sugar. There's not much sugar, so water's probably going to be moving into the cell. Those cells are probably big. It's full of water and not sodium. Sodium's on the outside. We're confused. The patient has a headache, maybe even some cerebral edema. So if you said that cell's probably looking swollen or swelled up, you're correct. Now, if your cell is swollen and enlarged, what sort of IV fluid do you want to give? If you said that you would give hypertonic solution or hypertonic IV fluid, you are correct. So think about that cell is full of water. It's basically drowning. We don't have a lot of concentration of sugar or even sodium in this case. So we're going to have to try to actually pull out all the extra water that's in the cell and move it outside. In order to do that, we need to use a hypertonic solution because it's going to make that cell smaller. Now, in our images, hypertonic solution shrinks the shell. We want that cell to actually go back to normal and monitor all three of those IV fluids for just fluid overload and making sure that we're giving those at the correct rate. So as just an overview, if we're thinking of IV fluids as sweet tea, there always needs to be somewhat of a balance between water and our sugar in our sweet tea, as well as what is going in and out of that tea bag, which acts as our cell. Golden rule is to remember that water follows the sugar. In general, water follows also sodium, or water moves towards the higher concentration. This is important because this tells us where the water goes within or outside of that cell. Isotonic solutions, that is our perfect sweet tea. It tastes amazing. The cell doesn't change. It's extremely happy. If we give isotonic solutions, we're just giving volume to the patient. Hypertonic solutions, that is our super sweet tea. A lot of sugar is involved, a lot of high concentration. Because of that concentration, not a whole lot of water is in there, so the cell is very shriveled up and shrunken because of that concentration. And then lastly, our hypotonic solutions. This is extremely watered down tea. Very little sugar, probably is not going to taste good. Because of all that water, that cell is full of water and really swollen. So we want to make sure that we're watching for all of our risk factors and understanding when we need to give these fluids and when it would not be appropriate to give these fluids.